people, they abuse antibiotics well, and it cause a whole lot of problems. And then after abusing antibiotics, they go on to take blood tonic. And always when we go here, we talk, say, doctor, you give me antibiotics, but add blood tonic. And when you ask them why did they ask for blood tonic, you hear things like, should be antibiotics, they dry blood. Then talk, say, antibiotics, they dry my blood. So I want blood tonic so that I mean my blood will finish. I don't really know where that thing come from. So today, make we talk about them. Now, I guess something where I need to talk quickly. I hope, say, people will go watch this video, go see this one. I beg. We know they do private chats. We know they do private chats. We know they give out number on social media. Yeah, in case you did hear. So antibiotics na medicine. This medicine na to fight bacterial infection. You dey hear me so? One na medicine. This medicine na to fight infection. Which one of infection? Bacterial infection. Now we dey use antibiotics for. But people, they abuse antibiotics well. And whenever they go clinic, they go hospital, doctor give them antibiotics. You go to hear, but why you add blood tonic for me? Why you give me blood tonic? So I don't really know where that discussion comes from. And we don't pass out from one generation to another generation. Say antibiotics, they dry blood. Now we get so many types of bacterial infection. Listen carefully. We get plenty types of bacterial infection, number one. Number two, we get plenty types of antibiotics. Also, many types of infection, they with bacteria they cause. Infection for your skin, infection for your blood infection, infection for the bone, infection for the stomach, infection for the private parts. So many types of infection, they with bacteria they cause. And you notice something, when somebody just feels somehow, the next day, you don't go wrong buy antibiotics, not even knowing whether that the right medicine they collect or being at the right diagnosis he gets. That is number one. And these antibiotics, when we use them at the right time, for the right condition, cure the day, person they fine. But we don't realize, say, some antibiotics too, not they work again. You know why? A lot of people don't they drink antibiotics like saying pure water. So most of these antibiotics, no, they work. So you go see somebody every time, go talk to the doctor, I dey treat infection. Maybe the antibiotics where they use they work again for your body because you don't abuse antibiotics, or you dey treat the wrong disease, or you dey take the wrong medicine. Now, one thing where they surprise me, they say people, they work out for social media, they look for medicine, they look for antibiotics on social media, not knowing that social media not be hospital, and there is no way you can treat yourself on social media. No, besides they try to make you fear. But if you want to treat yourself from whatever infection, you need to have a one-on-one discussion with a doctor, because I see things on this online, fear they catch me. Now, let's go to the next one. Say, some people take antibiotics and the antibiotics will give them problem. So we get some kind of side effects for antibiotics. You get how you go use antibiotics, it will give you problem. If you give you abdominal pain, if you give you skin rash, yes. And if you give you even vomiting, you understand? But most of the common antibiotics where we get, they really give us problem like that. Now, for a few cases, now these antibiotics actually they cause problem for some people body. So before you take any antibiotics, you get some things where you need to follow. And that is why I beg you. I don't know if you don't follow me to come say so. I be a new follower. We will tell you, say you will need to get a discussion with a doctor. Get a doctor. When we say whenever you get any problem like this, you go fit follow that doctor, talk one-on-one. We go fit guide you, because a lot of people don't become doctor for themselves. Your body they do you one kind. You think say you go just sit down, you go know the kind of medicine to take. Never. No, beside they try to make you scared. Never. This is why we have doctors. Be like your motor spoil. You are not an engineer. You're not a mechanic. You can't go they read how to repair car. You go spoil the car now. You understand? Good. Now, when your doctor prescribe antibiotics for you, they go tell you, say, take them for 5 days, take them for 7 days, take them for 2 weeks. But what we notice, they say some people, the moment they start the antibiotics and their body just they find small, they don't stop. They don't stop the antibiotics, not knowing that the whatever way they treat, whatever sickness, whatever condition way they treat, it still did the body. They will can't stop. Then later on, when they need that antibiotics again, or that problem come back, you drink the medicine, it not go work. I don't know if we get new followers on the page. If you just follow us on this page for the very first time, you do welcome. We appreciate you for joining us. We are very happy to have you here. But on this page, majorly, not teach, we teach. And we advise. We don't actually do medical prescriptions. We don't make diagnosis online. You understand? Yeah. So we're happy to have you here. And 80 to 90% of our teaching are in Pidgin English. There's a reason for that. That is actually the brand to make us different from others. So no vex. In case you know they understand Pidgin, no vex. Yeah, vex. Good. Now, when doctor tell you, take this medicine for 1 week, you will take them for 3 days, 4 days, and then when you feel okay, you stop, not knowing that this medicine never work finish. Gradually, you build resistance, antibiotic resistance. And then tomorrow, when you need the same medicine again, it no go work. You dey follow me? You dey hear me? If you dey follow me, you dey hear me, you dey understand. Put some in the comment section. I dey follow you. I don't understand. Now, there is another very big problem. You get some antibiotics where our people, they abuse well. They abuse antibiotics. Remember, antibiotics now medicine for treating bacterial infection. I repeat, bacterial infection. We get different types of infection. We get viral infection. We get fungal infection. We get parasitic infections. You understand? So antibiotics now for bacterial infection. And it gets some antibiotics where our people, they abuse too much. Like somebody listening to me right now, you where they watch me, for your house, you get flagyl, you get amoxicillin, you get ciprofloxacin, you get augmentin, you get all the antibiotics for your house. Whereas you no be doctor, you no be pharmacist, you no be nurse. Child. No, how you no go get problem? No be say they wish you bad thing. I know they wish you bad thing. No, I'm not. Trust me. But how do you think that all those medicine when you pack for your house, no can give you problem? They hear me, so abi? Good. And then you go see some ladies. This is common with ladies. Any small abdominal pain, antibiotics. Any small rash, antibiotics. And then you will complain, I get PID, I get this and this and this. Whereas maybe not be those things, you don't get them. Now just because of I too know, you feel you know too much, and you give yourself more problems. Now, maybe go another area. Blood tonic.